With the increasing rate of hospital-acquired infections due to antibiotic-resistant organisms, it's important that healthcare professionals take an active role in helping to prevent the spread of germs. After all, patients rely on hospitals and their staff to make them well and keep them healthy. And adopting a habit of good hand hygiene to reduce the spread of infection is easier than you think. This video will explain the benefits and procedures for proper hand cleansing with Purell Instant Hand Sanitizer and outline the why, when, and how of good hand hygiene with Purell. The goal of this presentation is to encourage you to begin a habit of frequent hand hygiene with an alcohol-based hand sanitizer to provide a safe and healthy environment for you, your co-workers, and your patients.
Here at Children's Hospital Medical Center of Akron, we've implemented a house-wide program using Purell Instant Hand Sanitizer for hand hygiene and to reduce the occurrence of hospital-acquired infections. And what we found is not only does the staff enjoy using Purell Instant Hand Sanitizer, but so do the patients and families.
Your facility has implemented the Purell Instant Hand Sanitizer program as part of a complete infection control program. By making Purell available throughout your work environment, you'll find it easier than ever to practice good hand hygiene. First, let's address why you should disinfect your hands. Microorganisms that may cause infections are easily passed from one person to another simply by the touch of your hands. In fact, the Centers for Disease Control and Prevention states that proper hand hygiene is the best way to stop the spread of infection. This laboratory test is a great example. It shows the bacterial growth present with hands that have not been washed, and the result after using Purell Instant Hand Sanitizer. 99.99% of germs are eliminated. Imagine how this could help reduce the spread of infection and illness. Let's now address some common misconceptions you may have about alcohol-based hand sanitizers and hand washing. Alcohol-based sanitizers are less effective than antimicrobial soaps. In fact, alcohol-based sanitizers are faster and more effective at killing a broad range of gram-positive and gram-negative bacteria, including the antibiotic-resistant organisms MRSA and VRE. Purell kills 99.99% of these microorganisms in as little as 15 seconds. Alcohol is drying and irritating to the skin. Purell is formulated with a unique system of moisturizers and has actually been shown in a controlled hospital clinical study to cause less skin dryness and irritation than soap and water hand washing. This means your skin stays soft and healthy looking even after frequent use. It takes too much time to hand wash frequently. Studies show that it takes 1/4 of the time to disinfect your hands using an alcohol-based hand sanitizer as it does to wash your hands with soap and water. With Purell, you can thoroughly cleanse your hands in as little as 15 seconds. And because you don't need a sink, water, or towels, you can use it anytime. Purell dispensers can be placed anywhere, at the entry to patient rooms, at the patient bedside, and at nursing stations. So it's always easy and convenient to use. And that's good news for busy healthcare professionals. Now that we've shown you why using an alcohol hand sanitizer makes good hand hygiene easier, let's look at when to use it. Purell can be used to disinfect hands whenever they are not visibly soiled. You should be sure to use Purell before patient care and between patient contacts, after touching environmental surfaces and equipment, and after sneezing or coughing. Disinfecting your hands is also necessary after using the bathroom, before and after smoking, eating or handling food, and after removing gloves. And of course, use Purell before any invasive procedure and handling dressings, catheters, bedpans, specimens, or urine. Also, be sure to encourage patients, their families, and visitors to use Purell to cleanse their hands and to help stop the spread of germs. By using Purell as part of your total hand cleansing regimen, you will keep your skin looking healthier as you practice good hand hygiene. Just as important as knowing when to use an alcohol-based hand sanitizer is knowing how to use it correctly. Purell dispensers are available throughout your facility. They are easy to use and require only one hand to dispense the product. To use a dispenser, first cup your hand slightly. Then, using the heel of your hand, press on the push bar to dispense Purell into the palm of your hand. Next, keeping your hand in a horizontal position, clasp your other hand over it and then rub them together as you move toward a handshake position. Be sure to coat all surfaces of your hands thoroughly, including your palms, in between your fingers, under fingernails, back of the hands, and around wrists. Rub your hands briskly until they feel comfortably dry. It takes about 15 seconds and no water or towels are needed. That's it! Your hands are disinfected. And because Purell contains a unique moisturizing system, your skin will feel soft and smooth, not dry or irritated. By understanding the need for good hand hygiene and knowing when and how to use an alcohol-based hand sanitizer correctly, you can take an active role in preventing the spread of infection and help protect yourself, your patients, and your family. Stay healthy by making a habit of hand hygiene today with Purell Instant Hand Sanitizer.